mainly end of 60s and beginning of 70s. At the beginning of this field, there were two main visions. The first was introduced by an oncologist at the University of Wisconsin, Van Rensselaer Potter, who died in 2001. And his vision for this science was basically a combination between biology and ethics. And he had a broader vision with global dimensions to it. The second vision was introduced by a medical doctor called Andre Helliger, who died in 1979. He was based at the University of Georgetown in Washington, D.C., and his vision of bioethics was focused more on the field of medicine, or in other words, a more updated version of the classical field of medical ethics. So different scholars and researchers speak about the factors and reasons that gave rise to this new field in the context of the 20th century, ranging from political factors or reasons and also social reasons like end of World War II, and usually this is tied to the emerging human rights culture and the framing of the Universal Declaration of Human Rights, especially in light of the atrocities that were committed in Nazi Germany, more particularly when it comes to abuse of scientific experiments on human subjects. Also, people refer to civil rights movements, particularly in the United States, and of course, scientific developments in the field of medicine and the emergence of medical technology like kidney dialysis, organ donation, transplantation, genetic and reproductive technologies. So all these technologies, as they were introduced, also they created a host of ethical, legal, problems, or rather dilemmas that people pondered on. So the Encyclopedia of Bioethics, which is the main reference in this field, defines bioethics as the systematic study of human conduct in the area of the life sciences and health care, insofar as this conduct is examined in the light of moral values and principles. So as you can see, this is quite a comprehensive definition that includes at least three main dimensions, as also elaborated in the Encyclopedia of Philosophy. These are ethical issues related to healthcare and medical research, and this would be, again, sort of synonymous with the classical field of medical ethics. The second is ethical issues related to the interface between the life sciences and biomedical technology, and the third, which is the broadest, is biological aspects of environmental ethics, which would include animal research, ethics, and vegetarianism, and environmental ethics in the broadest sense of the word. So I would like to point out two main dimensions to the emerging field of Islamic bioethics. The first is Islamic bioethics as a cumulative tradition. So oftentimes in the literature, people wonder or raise the question about how we should define Islamic bioethics and on what basis. So this is just offered as a kind of a tentative attempt to facilitate the process of defining and conceptualizing the concept and the term. By a cumulative tradition, I mean that it draws on the Islamic ethical tradition, Islamic ethical thought in the broadest sense. And in particular, within that larger Islamic ethical tradition, on the Islamic medical ethical tradition in particular. And within that Islamic medical ethical tradition, there are two streams or strains, if you will. First is one that is based and grounded in Islamic sources, that is basically as it culminates in the tradition known as the prophetic medicine, and the second one that draws on pre-Islamic ethical sources, as Professor Albar was referring to, pre-Islamic tradition. And usually these traditions have been also integrated and incorporated into the Islamic tradition, as we will see later on under the genre of adab. The second dimension to Islamic bioethics is what I refer to as Islamic bioethics as an ongoing discourse. And this means basically the constant and ongoing search for an articulation of Islamic ethical perspectives on the constantly emerging bioethical issues, problems, and dilemmas. So what are the sources of Islamic ethical thought? In general sense, of course, we have two main primary sources or foundations. This is the Quran. The Quran is mainly an ethical text. It speaks about ethics, all over the place. The entire message of the Quran is ethical, as we also heard this morning in the Quran. وَإِنَّكَ لَعَلَى خُلُقٍ عَظِيمٍ. Allah subhanahu wa ta'ala refers to the conduct and the behavior of the Prophet. And also the Quran is replete with ethical principles like justice, fairness, and the concept of the good in the most comprehensive sense in general. The second is the Sunnah of the Prophet, both as also instructions complementing and commenting on the Quranic text, and also in the form of documenting the practical example of the Prophet. So in terms of types of Islamic ethical thought, we have two main types. First is what we can refer to as virtue ethics, ethics that aims to develop the virtuous character. And the second is action ethics that focuses on the process of acting itself. So we have action ethics and virtue ethics. The first refers to, that is virtue ethics, refers to the character, how to develop the noble character, an ideal character. The second focuses on the ethical action itself. And both of them, of course, are needed for Islamic bioethics. When people talk about the behavior, exemplary behavior of the physician or people involved in the medical profession, and also in action itself. In terms of discourses, so these two primary sources throughout the course of the Islamic ethical tradition have been used in order to develop different discourses in different fields, like theology, as theologians, for example, wondered and discussed and researched the concept of the evil, the good, etc. In jurisprudence, both in legal theory or usul al-fiqh or substantive law or furu' al-fiqh as well. Also Islamic philosophy and mysticism. So each of these branches, if you will, develop its own perspective on Islamic ethics. So Islamic medical ethics, as I noted earlier, draws on two main resources. First is homegrown within the Islamic tradition, Islamic history, and as I said, it culminates into the genre of prophetic medicine, as we can see in the books with the title of At-Tibb al-Nabawi, for example, but also in the books of furu' or fiqh. Usually you find chapters related to the practice of medicine. The second is the genre that was incorporated and integrated, Islamized, if you will, and included into the Islamic tradition from pre-Islamic sources, as we heard most importantly from the Greek tradition with figures like Hippocrates and Galen and others. So in general, when we speak about ethical analysis, I distinguish three main levels. At the highest, what we can refer to as Islamic meta-ethics, and these would include the most fundamental principles, Islamic principles coming mainly from theology, like concept of tawheed and other fundamental concepts that would inform, lower levels of ethical analysis. And then the second is Islamic normative ethics, and here we talk about different varieties, at least three. First is the virtue ethic, Islamic virtue ethics, or how to develop the noble character, exemplary character. The second would illuminate the higher objectives of Sharia, particularly the fundamental ones like the 5 essential values: protection, preservation of religion, life, lineage, property, and reason, as we all know. And the third is Islamic obligations. Some scholars refer to these as equivalents or synonymous with the 2 main paradigms in Western ethical analysis, that is basically utilitarianism and deontology. And then the last of these categories is applied Islamic ethics, and here scholars would address, okay, thank you.
2 minutes to go.
Thank you. Would address the particular ethical issues in particular fields like economy, finance, and here Islamic bioethics would be a type of Islamic applied ethics. Quickly, Islamic bioethics as a discourse, I refer to 2 main features: that it is a public discourse and it is interdisciplinary. If we have room during the question and answer session, perhaps we can go back to these. Here I talk about a bifurcated reality, and what I mean by that, when we talk about the reality or the practice of Islamic ethics in the Muslim world, we see that in medical education, in colleges of medicine, we see that the teaching of bioethics is usually informed by the globalized Western medical ethics. While when it comes to the public discourse, usually this discourse is informed more by Islamic ethical heritage. And this is what I mean by the bifurcated reality. And this is manifested in many ways, but most importantly in discussions at the global level, at the level of the World Health Organization or UNESCO, for example, when we have, if you will, 2 parallel discourses, and the challenge would be to reconcile these with each other. So mapping Islamic bioethics, there are 2 main varieties, if you will, when we talk about Islamic bioethics. First, you find people approaching Islamic bioethics mainly from a juridical point of view, and here people talk more about al-tibb al-Islami, if you will, and ethics as part of that. And the second, as a type, or bioethics as a type of social ethics, which is more general than the jurisprudential vision. Here I talk about...
Could you please time up?
Sorry? Done? Okay.
You have got...
I would like to end...
No. Bismillah. Your time up, but Bismillah. We give you a bonus of half a minute.
Half a minute, okay. I just want to conclude with a project that we are working on here. Here are also the achievements in general. At Georgetown, Qatar, we are working on a project on Islamic bioethics for the past 3 years, and we have 2 main initiatives, basically. First is development of a collection and database of Islamic bioethical resources, and the second is development of the Encyclopedia of Islamic Bioethics. Many of the speakers here are contributors to this important resource, which is the first of its kind, and I thank them for their support. And I would like to also let the audience know, and if you have questions, I'll be happy to address, and also I invite your participation in these 2 projects. Thank you very much.
Thank you very much, Dr. Ayman Shaban from Qatar Foundation, for his enlightened speech. Now, IT people, please. Could somebody help Prof? Could you? Yeah. Just to give time to Prof. Omar Hassan Kasul. The name is Kasul, but it gives it rings a wrong bell. He is what he is in bioethics. A Harvard graduate with numerous publications in Maqasid Sharia and in bioethics. He's traveled worldwide, so many publications, and he's going to give us a talk on analysis of the medical decisions in the International Fiqh Academy from perspective of Maqasid Sharia and Qawaid al-Fiqhiyah. And Prof, are you ready?
بسم الله وعلى بركة الله
15 minutes.
والصلاة والسلام على رسول الله. Sisters and brothers, it's a pleasure to be here. Assalamu alaikum wa rahmatullahi wa barakatuhu. And I would like to start by thanking the National Bioethics Committee of Oman with the Vice Chancellor as chairman for bringing us together in this successful conference. The summary of my presentation is that the maqasid al-sharia and qawaid al-fiqh can be used to derive virtually all the ethical rulings that we have to deal with. And I did reach this conclusion by analyzing the decisions of the International Fiqh Academy, Majma' al-Fiqh al-Islami, headquarters in Jeddah, over the past 30 years, and I found that I could derive all of them from using maqasid and qawaid al-sharia. I just want to warn you, using qawaid al-sharia is not a dalil, but it can enable us to think through issues systematically. And what I look forward to is actually a book like Majallat al-Ahkam al-Adliya. This is a great book that was published towards the end of the Uthmani Khilafah. They summarize the qawaid al-fiqh, the principles of Islamic law, as they apply to business and commercial transactions. I wish we have a similar book applying to ethical principles in Islam. It will make doctors and nurses work much more efficiently because the principles are written and they're easy to follow and understand. Now, that's a summary of my talk. You can walk out. You know what I want to talk about. Now, I would like to start on a philosophical note, the issue of ethics and bioethics. In our Islamic tradition, we don't really have a term for bioethics, and this is historical. Our law, Sharia, comprises positive law and also has got moral law. So when we use our law, we have ethics embedded in it. In the European tradition, after the Renaissance and the Reformation and the Century of Enlightenment, there was a separation between religion and law, and positive or public law. And because of that, when medical issues came up in the 20th century, that required a moral approach, a new discipline had to be developed called the bioethics to deal with that. In Islam, we didn't have to do that because our law has got morality embedded in it. So we talk about this ethics as part of fiqh, as part of law or medical fiqh, which has developed in 3 stages. The first stage, rulings could be, ethical issues could be resolved by direct connection to the Quran and Sunnah. In the second stage, we didn't have the textual evidence directly to relate to problems, so they used the qiyas and ijma'. We are now in the third stage. Even when qiyas and ijma' break down, they cannot solve the problems because they are very complicated. So I think we are now in the era when we need to go back to the maqasid and qawaid to resolve contemporary ethical issues. Now, maqasid al-sharia is not a new thing in our law, but it has not been used over the past 10 centuries because there was no need for it. Why? Because our society did not technologically develop to create the problems that we have today. But as of today, we need to go back to this old concept because of the problems that we meet. But it's not new. Imam al-Haramain al-Juwayni, his student al-Ghazali, also Shaykh al-Islam Ahmad bin Taymiyyah, and his student Ibn Qayyim al-Jawziyah, they have got a lot of writings containing these issues of maqasid al-sharia. So the maqasid al-sharia open a new way of ijtihad about ethical issues that we face in our time. Now, the best book in this area is by the Andalusi scholar Abu Ishaq al-Shatibi, called Al-Muwafaqat Usul al-Sharia. It really states the maqasid, the main objectives of the Sharia very succinctly. And it has been published many times. You know, these are various issues of the book. And I think we all need to go back and read this book. Now, the 5 purposes of the Sharia that we can use to solve ethical problems are the following. Any procedure that you do, it either conforms to this or does not violate them, then it is ethical. The first one is protection of morality, حفظ الدين. Second is حفظ النفس, protection of life. The third is حفظ النسل, protection of lineage or the family. The fourth is حفظ العقل, protection of the mind. And the fifth is حفظ المال, protection of wealth or resources. So many issues that come up, you really can reason them out through here. ICU, we have to put somebody in ICU as long as possible. حفظ النفس, protection of life. But then you may come up with a problem about حفظ المال. Are we wasting resources? So this can be used to reach very robust conclusions about ethical issues. But then the maqasid on themselves may not be enough. We need also to talk about another issue of qawaid, because the qawaid go into more detail. Qawaid al-fiqh, the principles of fiqh, go into more detail about the issues that we face. Now, also they have got a history of evolution. They are very old. They were written about in the first centuries of Islam. And there are many books about them, and I did mention some of them. And I can show you some of these. Qawaid al-fiqh. Actually, Qawaid al-fiqh are equivalent to ethical principles. And I will explain. These are the various books that we have. I want to say that at the beginning, they were mentioned in the first centuries only briefly. Then, today, the most contemporary thing about Qawaid al-fiqh is this book, Majalat al-Hakam al-Adliya. It's now about 150 years old, but I feel that we need to have a similar book now in the area of medicine. This is very good in the area of business. Simple principles that can guide a practitioner easily to reach a conclusion. We need to have something like that in medicine. Now, the 5 qawaid, 5 principles, also called al-kulliyat al-khamsa, they are the following. The first one is qadat al-qasd. It says, whatever you do, it's the intention behind it that matters. There's a 90-year-old man, stage 4 cancer, you order giving him morphine to treat his pain. But in your mind, you want to rest him because you know morphia can also be a respiratory depressant. So you tell the nurse, give him morphia, and you write because of pain, but your aim is let him get euthanasia. So we say that we judge your actions by the underlying intentions and not what you write. The second principle is qaidat al-yaqeen. This says that our actions should be based on evidence. This is the evidential basis of all our actions. The third principle is that of mashaqqa, of hardship. In Islamic law, whenever we have got a difficult situation, in order to save life, we suspend all the laws, because saving life is very important. So this qaidat al-mashaqqa, it makes medical practice very flexible. The fourth principle is qaidat al-darar, the principle of harm. This is a balance between benefit and injury. Actually, most of the ethics is around here, and in previous research that I've written, the 4 principles of Chadres and Beauchamp, actually they all fit in just one of these. Belmont principles are all here, because this is a principle that deals with the balance between benefit and injury. And the 5th one is the principle of ada, precedent. In Islamic law, what is accepted by everybody in the profession is considered part of the law. So what I did, this principle of injury has got sub-principles. Inshallah, you can read them later on. Now, I want to talk about the International Islamic Fiqh Academy, because over the past 30 years, it has been giving legal rulings. What I did, as I told at the beginning, I made a summary. I went through and analyzed them, and found that we could have derived them using maqasid al-sharia and qawaid al-fiqh. In the 3 minutes that remain, this is OIC in Jeddah. I just want to give you an example. IVF. Why do we do IVF? Because we need to produce babies. You are fulfilling the third maqsad, which is called hifz and nasab. Then, after you do IVF, you may have extra zygotes. Should you destroy them? No, you cannot. Because why? You are destroying life. You are violating hifz al-nafs. Then, should we make IVF available for every citizen? Maybe no, because of the resources. It's about the maqsad of hifz al-mal. Now, should we allow donation of ova and sperms? No, we cannot, because we are violating the principle of hifz al-nasab. So the point is, you can reason them out using these basic principles of the law, and I really look forward to us producing a book of قواعد, a book of principles similar to مجلة الأحكام العدلية. Thank you very much. والسلام عليكم ورحمة الله وبركاته.
My apologies, Prof. I would have been very biased because it's a very stimulating, provocative presentation, inshallah, and we are hoping for a thorough discussion on these issues. Now, our third speaker for this session is Professor Mashal. He is a senior consultant in endocrinology and metabolism, chairman, Institutional Review Board, Islamic Hospital, Amman, Jordan, and chairman, Committee of Bioethics, the Federation of Islamic Medical Association, Amman, Jordan, and the man as the first speaker and the second speaker, he is as well heavyweight in Islamic bioethics with numerous publications, and the man is well versed in this field. I hope he will not have to unite us to oversight his 15 minutes.
بسم الله الرحمن الرحيم والصلاة والسلام على سيد المرسلين. No. Yes. Okay. Many thanks and appreciation to the pioneers in organizing this excellent and badly needed conference. I think that Professor Kasuli had made my life easy because he actually laid down the basis that I want to talk about. Contemporary bioethics in clinical practice and research has been based on internationally adopted standards that evolved over the past several decades, starting by the Nuremberg Code and then the Declaration of Helsinki, which was adopted by the World Medical Association. And the central point is that medical research should be subject to ethical standards that promote respect for all human beings and protect their health and rights. And then the CIOMS, which was founded in 1949 by WHO and UNESCO, and in 70s it produced guidelines to enable the effective application of ethical principles of the Declaration of Helsinki. And the first report was in 82, and it has been renewed several times. The last re-update was in 2002. The declaration, the CIOMS guidelines and the Declaration of Helsinki are based mainly on the generally accepted four ethical principles, which are autonomy, beneficence, non-maleficence, and justice. Although those codes of medical ethics have been adopted after World War II, yet unethical practices continue to proliferate. Over the past several decades, ethical deviations became a major concern because of two main factors. Number one, there are new developments in science and in medicine that needed ethical standards. Number two, moral values. As Professor Kasuli mentioned, that in the secular medical curriculum, morality to them is only communal consensus. Whatever people agreed upon is considered ethical. Literature is loaded with various deviations, both in practice and in research. This is just one example. Everybody knows the Tuskegee, Alabama incident, whereby black patients suffering from syphilis were intentionally left without a treatment just to know what is stage 1 syphilis, what is stage 2, stage 3, and stage 4, just to learn about it. And this continued until the mid-70s. President Clinton apologized in the 90s about this. The literature is loaded with such deviations. Now, the medical profession, including practitioners, researchers, and healthcare leaders, became increasingly squeezed and controlled by another factor now, which is the big business, philosophy of the big business. Across the world, complicated ethical, religious, social, and legal implications have erupted and proliferated. Over the past 2 to 3 decades, the pharmaceutical companies, a new factor now, gradually gained unprecedented control over research to evaluate their own products. And this has been published by Maria Angel in JAMA. They often design the studies, perform the analysis, write the papers, and probably some of you who are involved in research know that, and decide whether, when, and in what form to publish the results. In addition to grant support, investigators often have their financial ties to those companies. A survey revealed that about 2/3 of academic medical centers hold equity interests. They are partners in those companies. Most significantly, the FDA, the famous FDA in the United States, 16 standing committees that advise on drug approvals also have financial ties to drug companies. And this is Dr. Richard Newhans, when he talked about ethics in dealing with children's diseases. He published a book by The Best Bioethics Money Can Buy. And these are just few examples published in American and Western literature. Clinical research, therefore, could be often biased. Now, few words about Islamic dimensions on bioethics. There is a wealth of literature on Islamic medical ethics that was exercised since the early days of Islam. Past Muslim jurists had pioneering roles in bioethical issues derived from Islamic jurisprudence. The informed patient consent had been in application since the very early years of Islamic civilization. All scholars of Islamic fiqh required informed patient consent prior to provision of all kinds of care. Islamic jurisprudence has established principles of obtaining consent when the patient is a minor or unqualified or incompetent. Moreover, if the subject is minor or incompetent, actually the approval of the next of kin is not accepted because there might be conflict of interest. That's why we have an ethical committee or ethical councils that decide, especially when the research on a child or unqualified person serves that class of patients. So it is not open. Now, the principle of beneficence, doing good non-maleficence, avoid harm, and justice are all incorporated in the ethics of general Islamic conduct that every Muslim should acquire as a manifestation of Sharia principle, manifestation of faith. I think Professor Kasuli alluded to that. Contemporary scientific progress has made medical jurisprudence much easier. Scientific progress has been instrumental in clarifying bases and implications of many issues facing jurists. Many past medical issues which were not clearly understood and considered problematic have been clarified by contemporary scientific progress. I will not forget a scholar in one of the meetings that I humbly participated. He went to the doctor and said, Jazakumullahu khairan. You made our fatwa and our work very easy.
Prof.
Conferences, seminars, and consultations between scholars in Sharia and in medical scientific experts have been very constructive in clarifying issues that need fatwa. Such organized interaction have become a cornerstone in contemporary fatwa and Sharia opinion. Now, so those were discussed by Professor Kasuli, and we know about these things. We have the primary ones, glorious Quran, Sunnah. The others, when there is details. The first two address main ideas, and now they address and ijtihad, which is exerting effort to understand also. Any action by the Muslim must fulfill one or more of the purposes of Sharia. And we have the necessities, needs, improvements, and الضرورات. Professor Kasuli discussed about religion, life, progeny, and mind. And then القواعد الشريعة, حفظ الدين, حفظ النفس, حفظ النسل, all were discussed. Alhamdulillah, قواعد الشريعة. I just want to talk a few seconds about harm. In Islamic jurisprudence, they don't talk only about harm. They have Islamic jurisprudence is rich in this area. The principle of no harm. Harm, if it occurs, should be removed. Harm should not be removed by similar harm. Prevention of a harm has a priority over bringing a benefit. Choosing the lesser of two harms, and so on. Jazakumullah khairan, wassalamu alaikum wa rahmatullahi wa barakatuh.
Thank you very much. Wallahi, all the three were very enlightened presentations. And sometimes I may have to blame myself being hypnotized over giving more lenient because of the substance of the three presentations. Now the floor is yours. I would kindly request, we have had 3 lectures, so please don't give us a lecture. Otherwise your turn will come. Now Dr. Abdullah.
Assalamu alaikum wa rahmatullah. Thank you very much.
Dr. Abdullah from Dammam, one of eminent young scholars in bioethics.
Thank you very much for this important introduction to this conference. I just want to ask Dr. Ayman Shabana. I have 3 actually comments. For Dr. Ayman Shabana, he is from Georgetown University in Qatar, and we know that Georgetown University has a very important bioethics center in USA. I'm really follower of their Twitter and websites. I don't see actually any, what do you call, I don't want to say interest, but there is no much talk about Islamic bioethics on that center or discussion. In fact, it's very seldom and rare. And for Professor Omar Kasuli, I would like to draw your attention while you are writing your